What distinguishes palindromic rheumatism from other arthritis? Imagine experiencing sudden, sharp joint pain that comes out of nowhere, lasts for a few hours or days, then completely disappears. This pattern is a hallmark of palindromic rheumatism, a condition that sets itself apart from other types of arthritis. Unlike rheumatoid arthritis, which causes persistent, ongoing joint inflammation, palindromic rheumatism involves episodic attacks that resolve fully between episodes. These attacks usually affect one or a few joints at a time, often small joints like those in the fingers, wrists, or knees. During these flare-ups, the affected joints may become red, swollen, and painful, but crucially, they do not cause lasting damage or deformity. This is a key difference from rheumatoid arthritis, which tends to cause continuous symptoms and can lead to joint erosion visible on X-rays over time. Another important distinction is the disease course. Palindromic rheumatism follows a relapsing remitting pattern, with periods of symptoms followed by complete remission. In contrast, rheumatoid arthritis is generally a chronic, progressive disease that does not fully resolve on its own. Interestingly, studies suggest that a significant number of people with palindromic rheumatism, somewhere between 28 and 67%, may eventually develop rheumatoid arthritis or other autoimmune conditions. However, this is not always the case, and some individuals never progress beyond the episodic phase. This potential progression hints at a possible link between palindromic rheumatism and rheumatoid arthritis, but they are still considered distinct conditions with different underlying mechanisms. When it comes to immune markers, many patients with palindromic rheumatism test positive for autoantibodies like rheumatoid factor and entacitrulinotide protein antibodies, which are also common in rheumatoid arthritis. This overlap suggests some shared immune system features. Yet, palindromic rheumatism also displays characteristics of autoinflammatory diseases and crystal-induced arthritis, indicating it has a mixed autoimmune and autoinflammatory nature. This duality helps explain why its presentation can be quite different from the persistent inflammation seen in rheumatoid arthritis. Demographically, rheumatoid arthritis tends to affect women more than men, whereas palindromic rheumatism affects men and women more equally. Diagnosing palindromic rheumatism can be tricky because there is no specific test for it. Doctors relying heavily on a detailed history of episodic joint attacks and ruling out other conditions. Blood tests for autoantibodies and imaging studies like X-rays can support the diagnosis but are often inconclusive, especially early on when joint damage has not yet occurred. The episodic nature of symptoms and the absence of lasting joint damage make diagnosis more challenging compared to rheumatoid arthritis, which usually shows persistent symptoms and joint erosion. Treatment approaches also differ. Since palindromic rheumatism does not typically cause joint destruction, management tends to be more conservative. Non-steroidal anti-inflammatory drugs are used to relieving acute flare symptoms, and certain medications like hydroxychloroquine or sulfasalazine may help reduce the frequency of attacks and potentially delay progression to rheumatoid arthritis. In contrast, rheumatoid arthritis often requires continuous, aggressive treatment to prevent joint damage and preserve function. Understanding these differences is essential for accurate diagnosis and effective management. Palindromic rheumatism is a fascinating condition because of its episodic nature, its potential to evolve into rheumatoid arthritis, and its unique immune profile. Always remember, individual experiences vary, and consulting a healthcare professional is the best way to get personalized advice and care.